Well, on your first visit, it's very important that you disclose any information regarding your history. Our spinal consultants will perform a thorough assessment, which includes an interview process to start off with to identify any potential clues. It is also useful to bring along any past imaging results, for example, results from X-ray, CTs, MRIs, and ultrasound, and disclose any medical conditions you have. So, for example, things like diabetes, hypertension, past surgical history, any ongoing medication you're taking, etc., etc. The second step, our spinal consultants will look at your body's range of motion, check your muscle flexibility, joint mobility, nerve tension, and your coordination. And please note, all of our test procedures are very gentle and does not require any invasive procedures at all. Upon conclusion of our examination, our spinal consultant will be able to explain the origin of your symptoms and commence treatment, form a treatment plan to go forward. It is vital that the patient follows through and 100% compliant with our treatment plan in the first 3 weeks, which is the golden period for most of our patients to gain the most results. I would like to take this opportunity to share a case study with you so most of our audience can understand the value of our service. So we had a client, just call this S for the sake of this conversation, who has suffered chronic sciatica, leg and foot numbness, and back pain symptoms for 2 years with no results from past treatments. The symptoms started to become worse and was starting to affect her mid-back as well. Upon examination, it was found that sciatica and lower limb symptoms were a result of overused hip flexor muscle and calf muscles, which is a result of compensation of poor mobility in the patient's hip joints. The patient's abdominal muscles and mid-back muscles were also affected as a result, which explained a lot of her mid-back symptoms. In the end, the patient's lower back and sciatica nerve were perfectly fine. I directed treatment to the correct area. The patient was able to become symptom-free after 3 weeks of treatment and is out running better than before without back pain or sciatica.